Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Lawrence Gostin, a Georgetown University professor and public health expert, about how the U.S. is obligated to the rest of the world when it comes to supplying COVID-19 vaccines, and how the donation model being deployed is no substitute for providing the patents so other countries can make vaccines themselves. Let's listen. Lawrence Gostin, thanks so much for joining me.
It's a pleasure to be with you. Thank you for having me.
So we had you on earlier in 2021, and we talked about the global vaccination picture, and it was looking very grim. And I wanted to know where we stand today and what is the role of the U.S. in making a global vaccination effort a reality?
Well, we're at a truly disappointing, almost pitiful level of global vaccination. The overwhelming number of doses have gotten into the arms of high-income countries, the United States, European countries, the UK, Canada, certain high-income Asian countries, and the rest of the world, particularly sub-Saharan Africa, has largely been left behind. And we even see that, health workers and other frontline workers in some low-income countries haven't been vaccinated and continue to be at risk. That's, scandalous in this day and age when we have a life-saving vaccine and that life-saving medical resources pretty much exclusively for the benefit of the rich, leaving the poor behind. President Biden made a pledge at the UN General Assembly's side session last September, where he pledged to vaccinate 70% of the world's population by this coming September. He's really failed to meet that pledge. The United States has pledged, roughly 1.2 billion doses, which itself is just a drop in the bucket. We'd probably need something like 11 billion doses. But it's delivered only about 270 million doses. And so it's way behind even in its inadequate pledges. So while President Biden is for sure the best performer in terms of global vaccination among any world leader, he's just not done enough, and other world leaders have been even worse. And so I'm very disappointed because we do have the tools to vaccinate the world, but those tools are remaining in our toolbox and they're not being utilized.
Talk to me about what some of those tools are.
Yeah. Well, most of the discussion is around vaccine donations, and particularly the United States and other high-income countries are expected to have huge surpluses of vaccines by the end of the year. And those surpluses, in many cases, are going to be expiring soon. And so donations are certainly the quickest and fastest way. If we were to really ramp up donations from the United States and all of our allies and partners, it could make a huge difference. But I've increasingly come to the view that charitable donations are a cruel and antiquated method of global health assistance, because as any African will tell you, donations always seem to come too little and too late, well before COVID, but certainly during COVID. And that's absolutely been our experience that it's true. And so what low-income countries need is not so much to kind of beg hat in hand for a donation. They want the ability to make medical resources themselves. They want to be able to make cutting-edge treatments like antivirals. They want to be able to make and produce high-quality vaccines themselves. And the best candidate for that are messenger RNA vaccines from Pfizer and BioNTech and Moderna. The reason is that they can be, production can be ramped up to scale much more quickly and easily than with traditional vaccine vectors, because it's really just simply sending a genetic message, and that can be done quite rapidly in terms of scale up. But Moderna and Pfizer have behaved, in my view, as very poor global citizens. They could have been the heroes of this pandemic, but instead they're becoming the villains because they're refusing to transfer their technology to low-income countries, including the WHO-backed mRNA hub in South Africa. And President Biden, while he's frustrated with their failure to transfer their technology, I'm just going to get rid of that. While President Biden is frustrated with Pfizer and Moderna for failing to transfer the technology, he's not willing to use hardball, for example, deploying the Defense Production Act to require them to provide and sign technology transfer agreements. So basically, there's this secret sauce, this recipe for making a life-saving vaccine, and our for-profit companies, which have gotten billions of dollars of U.S. Government funding and largesse, are refusing to share it with the rest of the world. And that's, it's immoral, it's wrong, and President Biden should not stand for it.
Mm-hmm. There's a lot of boosting going on in the high-income countries right now. People are getting their third shots, these boosters. In fact, the FDA just approved them for the Pfizer booster for 16 and 17-year-olds. At the same time, the WHO is saying, we don't have enough vaccine around the world, and you're giving boosters in the United States. Where should the balance be?
Yeah, I think, first of all, there shouldn't be such a directly opposite message and signal from the United States and the rest of the world compared to what WHO is saying. WHO's recommendations and its guidance should be followed, but it's not. And so there's something terribly wrong with that. Having said that, I really don't believe that this is a zero-sum game. I don't believe that you either boost or you vaccinate the world. I believe we can do both. And we do have the technology to do it. We just have to make the investments. We need to invest in vaccine infrastructure in low and middle income countries so that we have trained vaccinators, robust health systems, cold chain capabilities, transportation and electricity, and also outreach and health education or vaccine literacy. At the same time, we need to really ramp up the global supply of vaccines. And that's very doable, particularly with this new mRNA technology. We're just not doing it. And so I would feel a lot better about the US booster campaign, and that's a very aggressive campaign, if at the same time I thought the Biden administration was being just as aggressive in vaccinating the world, but he's not.
Is there a plan on how to vaccinate the world?
There isn't, and I've written op-eds in the Washington Post and elsewhere saying, it's all well and good to have a goal of vaccinating 70% of the world by next September, although I'd like to see it 80% fully vaccinated. But if you don't have a plan to get there, it's just pie in the sky. And we have no plan. There literally is no plan. The only thing I've seen is that President Biden promised to spend $1 billion or more on increasing domestic production of mRNA vaccines. But that's going to require companies to apply for it, presumably one of the two mRNA companies, and then to get it all sorted out. That's going to take months. We don't have months. And the United States shouldn't be the engine for vaccinating the world. We should certainly be vastly increasing our domestic production. But there's no way you can do this fast and fair unless you provide the technology so that companies around the world can produce their own. Places like the Serum Institute in India, companies in South Africa, Brazil, Indonesia, and others are clamoring to get the secrets and the investment for them to make vaccines. We should be making vaccines not just for COVID, but for future pandemics and epidemics. We should be making it possible to do that regionally so that people don't have to wait for a charitable donation and they don't have to beg for it. They have the capacity themselves to manufacture life-saving medical technologies.
Do you think this will change in 2022, or will this be more of the same?
Well, I think by 2022, we're going to see more donations, but I think it'll still be a donation model. And I really don't see us ramping up donations to make a real dent in this until late in 2022. And in the meantime, there'll be hundreds of thousands, if not 1 million people who will die fully preventable deaths.
Mm-hmm. And this would be eased if they could make the vaccine in their own countries.
Yeah, it would be enormous, and it's not just for now. This is an investment in the future. So we don't want to go to another pandemic or another health crisis and go through the same scenario of supply scarcity and gross inequity again. But that's where we're headed.
Mm-hmm. Sounds to me like we haven't learned a whole lot yet.
Well, we've learned to be greedy and selfish. We've learned, my country first. And the idea of my country first may be a bipartisan thing in the United States. While President Biden is certainly much more polite about it, he behaves in similar ways as President Trump, which is making the goods of medical resources available to America first, and then worry about the world. I mean, you can see it all around you. I mean, the messaging of the Biden administration is all focused domestically. Get vaccinated, get boosted. It applies to everybody. Do it now. We've got enough doses for you. We're not seeing that globally, not even close.
Lawrence Gostin, thanks so much for joining me.
Thank you very much for having me. I really appreciate it.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.